Welcome back, everyone, to another episode of HealthSparx, featuring the brightest entrepreneurs and innovations from the health and technology arena. I'm Michael Walsh, your host. So glad you could join us today. My guest today, Dr. Goldie Erowele, the editor-in-chief of Carenovate Magazine. She just recently put out her first issue of the magazine. It's fantastic. I'll have the links here on the episode page for you guys to check out. Goldie today, she's joining me from Houston. All sorts of great stuff we're going to chat about today, including what the magazine is, how it can help patients and caregivers and inform them about important topics like medication management, safety tips, advice, all sorts of tools and things like that caregivers can be using and checking out to manage whatever it is that they're dealing with in terms of themselves, their family, their loved ones, yada, yada, yada. So Goldie as well, she's going to share some of her own advice. She's going through this process as well. She's caring for her father, I believe. So great tips and advice from her as far as all of us caregivers out there, what we can be doing to better manage, our loved ones, but also make sure we're taking care of ourselves. So very important stuff today. Excited to welcome her on. Before we get started with Dr. Erowele, of course, want to mention to please subscribe to HealthSparx if this is your first time stopping by. All this is just my way of delivering the content to you each Tuesday morning that I post new episodes. I'll just send you the link and send you some basic information about who the guest is and what we'll be talking about. So promise no spam, just an easy way to get your hands on the content each week. And of course, we're available on iTunes and Stitcher Radio. You can check us out in those forums. And please, if you do, leave us a review. I'd love to hear your feedback about what you think, about how things are going so far. This is going to be episode number 21 now. Can't believe it. It's gone so fast. But would love to hear from all of you guys. So if you have any feedback, that'd be great. And of course, last but not least, I have to always just throw a quick shout out to a huge supporter of mine, the good people over at Satori Tech Solutions. They do a lot of great work for me for HealthSparx, as well as some of my other technology projects. So interested in maybe launching something of your own, just get a hold of me. I'll make some introductions to these guys, whether it be web development or mobile app development or anything like that. Lots of opportunity in healthcare now, guys, to launch something great. So definitely set time with these guys if you're interested. So without further ado, let's get into it. It's Dr. Goldie Erowele. Everybody, today on HealthSparx, I am joined by Dr. Goldie Erowele. Very excited to have her on the show today. Let me quick go through her bio before we get going. So Dr. Erowele is a clinical pharmacist with an adjunct and an adjunct professor who has authored and co-authored several pharmacy journals, book chapters, and serves as a reviewer to multiple journals as well. She's a member of the Kappa Epsilon Society, ASHP, and AMCP. I'll have to have her define those for me in a second. Previously, Dr. Erowele worked at the Walter Reed Army Medical Center as a pharmacotherapy. You give me way too many tough words, Dr. Erowele. Too early in the morning for these words. Pharmacotherapy specialist in areas of geriatrics, formulary management, internal medicine, and intensive care. She received the U.S. Army Commander's Award for Civilian Service and the Mel Leiter Clinical Pharmacy Award. Currently, she is the editor-in-chief of Carenovate Magazine, which, quick side note, is an awesome publication. You guys are going to have to check this out. A social health magazine that is dedicated to providing caregiving, health literacy, and medication safety insights and tips for caregivers. So, got through it. I made it. Dr. Erowele, what's up? How are you?
Good morning. How are you? I'm good. How you doing?
I'm great. So happy that you could join us. Very excited about all the work you're doing with Carenovate. And before we jump into that, let's just quick touch on all these incredible things that I just mentioned in your bio, and some of them I butchered. But let's start with some of this. So with your diverse background in mind, I mean, you've got your hands on a lot of different things. I'm curious, just getting to know you a little bit, which specialty or focus have you found to be the most rewarding throughout your career?
All my experience has been wonderful. Before I went to Walter Reed, I was actually at the VA Medical Center in Washington, D.C. for about a year. That was a residency program that I did right after pharmacy school, PharmD program. And it was, at that time, it was the most exciting thing for me. And I get to work with a lot of geriatric patients. We had a lot of referral from physicians, worked with nursing. So it was kind of exciting to do that. I went to Walter Reed and I was like, wow, okay. So, it was a different hospital, different platform. Got to do geriatrics. But I think the most exciting, I have several favorite things about pharmacy, but I think the one that really blew my mind was working in the ICU, actually, when the war started. So I was asked to round in the ICU with the medical team. So seeing the soldiers come back from the war with IED wounds and traumatic brain injuries and things like that, that was exciting, but also difficult. But I think my passion has always been geriatrics. You know, it always brings me back to geriatrics. I'm a caregiver to my dad, so it always takes me there.
You know, I can't even imagine the situation with some of the soldiers coming back. I mean, you compare the situation that you were in and that type of situation versus like being just in the normal emergency room of a hospital. I mean, can you even compare the two?
No, you know, it was sad. You start running with the medical team and you get to know these people, you get to know their families, and you come the next day, 5 o'clock in the morning, getting ready. You have a couple of patients in mind. You're hoping that they're doing much better, possibly can go to a step-down unit, and you get to the room and 21-year-old, the bed is empty, and you're wondering, okay, they went to step down, and unfortunately they passed away for whatever reason. So it's hard, especially when they're young, you know.
So tell me a little bit about some of these awards and these recognition that you received. I mean, for your service. I mean, this U.S. Army Commander's Award for Civilian Service, and again, did I pronounce it right? Is it Mel Leiter?
Yes, Mel Leiter. Yeah, Mel Leiter was a clinical pharmacist award that they've been going for years, and they give it for. Well, when I was at Walter Reed, a lot of people was like, "Oh, so were you in the military?" No, I wasn't. I was a civilian pharmacist, which is typically the heart of our department. You know, you have military pharmacists who work for a month and they have to be deployed the next month. So the civilian pharmacists are the one who kind of keep the ground running at all times. So my award actually came about working in the ICU, and one of the infectious disease physician who's the chief of their department had wanted me to work with them with their HIV clinic. For what I do with preceptorship and being an adjunct professor, we had to precept and teach, future pharmacists. So we didn't have a practice sites for HIV, and we had a huge HIV clinic. So I actually did the business plan. We didn't call it a business plan then. We just, it was a proposal to develop a pharmacy practice clinic that when the physicians see the patients and they leave in, I'll be the one, or any pharmacist will be the one to see the patients last, go over their medication, go over drug interaction. That experience, I actually got a publication with one of my students out of it. So I think all those effort was what led to the award.
Well, yeah, congratulations again. I mean, just for all the service to helping these folks. I mean, they obviously they need great people like you, right there to walk them through some of the things they go through. So we all appreciate it. Let's get into Carenovate a little bit. So kind of what led you to do this? I mean, this just launched, correct?
Yeah, well, Carenovate Magazine just launched. Carenovate, we've actually had it for about a year. It kind of started out as a blog. Then we had some other thoughts about caregivers, connecting caregivers with care seekers. But it didn't really take off that way. And it just kind of ended up being a blog at one point. Just giving medication safety, medication management tips to caregivers, because it was the time pretty much when AARP and had came up with a study, medication management being one of the problems. And we knew as pharmacists, as people in the medical field, we know that is an issue for everyone, coordinating family members' medications, especially for older people. Parents, grandparents who take anywhere average of 6, 7, 8 medications at a time. In clinics, I've seen people who take 15 medications at a time, and they have to take those medications.
Right.
We've seen people who take 22 medications, and we help dial it down to maybe 12 or 13. So, we've always known that there is a need, especially caregivers need this help. So I think I took a break because of children from the blog. I checked my email one day and it was all this. I had physicians email me, nurse email me like, oh, what happened to the blog? Are you still blogging? So I'm like, okay, well, maybe there is a need here. So I continued to blog. And actually a friend of mine who is not even in healthcare was the one who said, Goldie, you really need to make this bigger. I take care of my parents and I read your tips and I think you can make it into something bigger. So, and fast forward, decided to launch it into a digital platform to focus. And our focus really is with my background, medication safety tips, health literacy, because again, we have a lot of patients leaving doctor's office not understanding what instructions that they just got.
Yep.
And, also from my perspective being, I was a nursing assistant before I became a pharmacist, and my pharmacy career took me majority with geriatrics, and now I'm a family caregiver too. I'm lucky I'm sharing that responsibility with my siblings, but from that perspective and first line experience, at the same time give caregiving tips.
Yeah, I was just gonna say I'm sitting here checking out the site, and I love the tagline. I mean, total kudos to you, empowering caregivers, women, and chief household officers globally. I mean that's awesome, really nice. So this magazine, the first one you just put out, I'm guessing then, because I remember reading through it here this past month or so when you put it out, right?
Yes.
All right. So how can this magazine, like, you just kind of gave us the background, but how do you feel like the content and what you're putting together can really help a patient or a caregiver? Like, what is it they're getting from coming to Carenovate Magazine and, like, reading through it?
Well, we know several reports, several studies are indicating that caregivers are going online searching for health information.
Mm-hmm.
Being a pharmacist, among my friends, I'm kind of that go-to. I don't know what it is, but I'm kind of the go-to person for searching for deals online. I love research. So
Sure.
Airline tickets, help me find one. But
Goldie, I need you to book me a hotel room this weekend.
I know, like where do you buy your best deal? So, when it comes to health information, I'm kind of that go-to person in my network and, among my family members. But, I do know, that, when my mom gets all my friends have pain in their back, they go online. Mm-hmm. And it's the same thing with caregivers. And even so now with smartphones, iPad, iPhone, everything, they're going online looking for health information. There are a lot of wonderful resources online. But with Carenovate, the focus is really the three major problems that I see as a care provider and also a healthcare professional, and it's not really just for caregivers as well. It's for caregivers. I have a lot of healthcare extenders who actually love the magazine. I have a lot of nurses who actually have given wonderful reviews about the tips and, which part of the magazine that they love. And they love the little tips here and there. Did you know? And we did that just because as a caregiver, I know we don't have a lot of time looking things. So it's kind of like a centralized area for caregivers to go and, get information. I know that patients come to clinic to me and they say, Dr. Erowele, I found this thing on my metformin for my diabetes on Wikipedia. And that blows my mind how often that happens. Wikipedia is not a good source for drug information. We tell our pharmacy students the same thing too. Do not go there because anybody can get that information unpublished. There's a lot of stuff that gets published online. Mm-hmm. So that's another way we vet this information just based on our expertise. We have physicians who are contributing to the magazine. We have nurses. I have a nurse who's doing an elder care series for 8 elder care series on the magazine. We have a psychiatrist who's going to be contributing as well. So, these are healthcare professionals who are giving specific information that it happens to be a main issue for our caregivers now.
Now, have you opened up the forum a bit for caregivers themselves to come contribute to this?
Actually, I do have one. I have actually 2 caregivers. And 2 caregivers in the Houston area who's, doing amazing thing in their, on their side of town, doing consulting and giving advice to people in their community about caregiving. So yes, I am absolutely opening up to caregivers as well because, they're the one who juggle this every day. And,
right.
I have a lady and she's also a big advocate for issues that sandwich generation families are going through. So, of course, these are also caregivers who are caring for young children and also caring for their aging parents at home. So they also have a huge set of juggling act to manage and coordinate on a daily basis.
Yeah, you find it's interesting. You find that we've become, kind of to your point a little while ago, we've become a society that we go do our research online and we very much appreciate, the feedback from fellow, consumers, caregivers, whatever the word is in the situation you're in. But that feedback about, whatever it might be, in this case, a particular provider or a particular situation, how it was handled. And just knowing that someone else is out there going through what you're going through really does bring comfort to others, I think.
Absolutely. It's that support. It's that online support that, and that's really what this is. This is, a place where, you can get tips and see, exactly what you said, that know that other people are going through the same thing, and see how you can use your experience to, make things better with your life. I mean, coordinating schedules is a huge thing. So just getting those tips and getting to hear from other people who are going through exactly the same thing you're going through, it helps a lot.
All right, so I'm going to ask you the $1 million question here. So how many pages was this last magazine, this magazine you put out, this first issue?
I think 66.
All right, so here, this is probably the toughest question that you're ever going to get asked about your magazine. Which is the best page of the magazine?
Oh wow, the best page of the magazine.
You just handed me your magazine. I have got 60 seconds to read it. What is the best page in the magazine?
Oh wow. Oh, you want me to give you the number?
Maybe not the number, but just like, what do you think? You're the editor-in-chief. What is the best page? What's the best column? What is it in that magazine that
I think the best one about communication, the 6 tips on how patients and providers can communicate, because, I think a recent study went out recently. I can't remember if it was Health Affairs that put out a study where more than 50% of patients are leaving the doctor's office, and if you ask them 5-10 minutes after, what are you supposed to do with this medication, they have no clue. So right. I think the tips about how to ask questions, and it's amazing. I did retail pharmacy for a little while, and I literally sometimes, and I know a lot of pharmacists do this, literally have to force patients to ask questions. And even, with independent pharmacies where you have a lot more privacy, where you can go to a corner and talk to a patient, it's like, begging to ask questions. I just did a talk for Dress for Success Houston, about 70 women, and we're talking about medication safety tips. And I had a lady who was taking, how she has arthritis, taking Motrin, Advil, and Tylenol. And I'm like, did you talk to your pharmacist? And, they're like, well, this pharmacy, I just, it's over the counter, and I just buy the medication to help me. You know what I mean? So I don't think, and as a pharmacist too, I don't think a lot of patients are taking advantage of the free resource that they have in their community pharmacies, asking questions. So I think that my favorite would be that part, because I think it's very, very critical about how to ask questions, how to communicate with your provider, how to get ready. And then even for providers, use of medical jargon. We need to use more plain language for our patients so they can leave and understand what they're supposed to do or what they're supposed to follow up on. Using medical jargon is not going to help. You really have to come to the level of the patient and use plain language. So I'm a big proponent of that.
This theme keeps coming up. It's been like the last month on the show. Like my guests, we continue to come back to, as much as we poo-poo on healthcare and all the things that we do wrong in healthcare, the theme kind of, for some reason, keeps coming back to the patient, the caregiver, their family, and they have just as much to do with this whole process as anybody, right? And they also have to be responsible and ask questions and
absolutely
be involved.
Yes. And when I did my talk for Dress for Success in Houston here, my thing is, I asked everybody, raise your hand, who shop for car insurance, who shop for home insurance. You do the same thing. If you don't feel comfortable, you have to go to your doctor and be ready, be ready for that visit. Just like when you go to buy a car, you're ready to make that purchase. Be ready for that visit. Be ready for the question. Own the visit. It's not just for the provider. It's also for you. Yeah. So you can stay empowered and understand what needs to happen. And that's really what happens with medication adherence, that we are all, working, to find solutions for, and I think that's a major part of it.
Definitely. So let's take a step back, looking at the bigger picture of just the landscape of caregiving today. There's a lot of different things that caregivers have to manage, not just caring for the loved one, but they've got to maintain their own health and finances, take care of their own families, go to work every day. In your opinion, what is the biggest challenge caregivers face today?
I would say personally, It's the idea, especially the ones taking care of their parents, is lack of self-care, I will say, because I kind of, when my dad is here, it's all about, you focus on making sure that he's okay. He's legally blind in one eye, and, he's older, he has health conditions. So, of course, trying to juggle work schedule, try to juggle what I'm doing with Carenovate, trying to juggle, I have 3 children, who are in elementary and pre-K. So, and my husband is very, very supportive, but it's forgetting, to take care of yourself. And like I said earlier, I'm lucky to, at this point have support. But there's a lot of caregivers who don't have that support. But it doesn't mean that they shouldn't take care of themselves, because, a healthy caregiver is going to be able to provide care.
Right. And so I was just gonna ask you, how can they work to solve that? How can they be better about that?
Just little things. It doesn't have to be, you don't have to take a whole week off. If you have the opportunity to do so, please do so. But respite care, there's a lot of resources. There's a lot of online support out there. Lots of Helping Hand is one of, huge organization that you can reach out to in your community. You go to their website, type in a zip code, and you can actually find support. People get surprised when I tell them, check with your church. There's a lot of, family-oriented communities in church, in neighborhoods, where, they are more than happy, they're like a family and they provide support. So even if it's simple, someone helping to go to grocery to pick up something for a caregiver, or, just coming over, okay, let me sit with your dad, or you're someone who's receiving care from you while you go for a walk and get some fresh air. Simple, meditation. I'm into meditation these days.
I've never tried it.
Yeah, I'm really getting into it and learning it. A friend is getting me into it. And it actually, even at work, there's just times when, you're so bogged down into looking at data and looking at dollars and looking at, everything. You just need time to yourself. Turn off the phone, take a walk for 10 minutes. It does wonders. So there are little things that caregivers can do, those are a combination of things that they can do, and then I think another thing too is, I don't know what it is about us caregivers, but, that whole idea of, I want to do it. He's my dad. He's my mom. I'm going to do it. And not asking for help.
Right.
They are bad for asking for help. And it's amazing what happens when you ask for help. People are either going to say yes or no, but most time they will say yes, so.
Yeah, it comes back to it again. It's a team effort in healthcare. It's not just, you can't do it alone. You can't rely on the doctor to do it all alone, the pharmacist to do it all alone. It's got to be kind of everybody.
Absolutely.
All right, so now taking an even bigger picture stance on what's going on around us, what are you most excited about here in the next couple years in healthcare? Just a lot of change going on right now. What's got you really excited about what's happening?
Well, pharmacy, I will take pharmacy first. I think pharmacy is getting to the point where other providers are recognizing that pharmacist is not, there to, lick, the label and stick it on the bottle and then hand the medication over to a patient. Pharmacists are doing a lot of great things. As a pharmacist, I've had the awesome opportunity to work in different areas of pharmacy. And I think as a pharmacy organization, we are, promoting heavily now, and people are actually getting to see. I worked in an institution where the internal medicine department paid for my salary. So that speaks volumes. And that at that point, it hasn't gotten to a lot of places where the physician was like, well, I have a social worker, I have a nurse, I need a pharmacist in my team because, we do provide care. We are so cost effective. It's ridiculous. Pharmacists are still so underutilized, So I'm excited about, that movement about, the possibility of, pharmacists providing certain services and being,
playing a bigger role in the whole thing.
That cognitive role that they provide, because we do. I mean, right now, one of my roles that I provide, I manage, pharmaceutical budget for an institution where I'm responsible to help coordinate care for indigent patients. So with that limited budget, I have to work and do a lot of stuff. And it's amazing when I tell people that are my brothers, they're like, well, a pharmacist does that? Yes, a pharmacist does that. So there, in that case, there's a lot more opportunity for pharmacists to do what they do and do it well and take care of patients and improve care, improve outcomes. Right. With what's happening with healthcare insurance, I'm still learning with that. I get a lot of questions about, I'm in Texas, so there's a lot of questions is like, what's going to happen? We deal with a lot of patients who have no insurance. Mm-hmm. Excuse me. And, they come to our institution, which is a county institution, where we see all those patients who other institutions don't see, so, and we work trying to get a lot of patient assistance from them, from, drug companies to provide, the resources that they don't have. So that's an area that is kind of great for me, because I can't imagine a cancer patient not being able to afford their medication, not able to afford to get treatment. So, it's exciting time, because I can't wait to see what will happen with this. And it's amazing how a lot of people are still clueless about what's happening with, Affordable Care Act. And I know there's a lot of movement with trying to put the word out and educate consumers, patients about October 1st and those type of things. So.
Yep. And I know that's something that I'm really focused on too. And that's a good point for your next magazine, maybe, to make sure that you've got some stuff in there about it, because you're right. There's still a huge gap in the knowledge base as far as general consumers and how this is going to work.
Yeah.
So it's a huge opportunity for us to be kind of the educators and tell people what's really going on, so that, again, like, that leads to them making better decisions about, their family or their care.
Absolutely.
So, all right. Well, this has been fantastic. I've sat here and written a bunch of notes. You've given me a lot to think about. You've really put out. Well, this has been. You're a very unique guest in that your background is a little bit different than some of the folks I've had on. So you've given me a lot to think about, and certainly plenty that we can share to people about everything that we've talked about here, what they can do to be better patients and caregivers, and even little things like you said, like taking a few days to maybe get some help in from your church or. These are great things. So all important things for people to think about. So this has been great. I really appreciate you taking the time to come on, and all the best with the magazine. And let me know anything I can do to help promote it. It'd be great to share some of the content you're putting out with people, that even for CareLoop as well. All the stuff you're putting together would be really great for our users too. So
absolutely, and I appreciate that.
Yeah, all the best to you, and definitely. Keep in touch and let us know how things are going down in Houston.
Okay, that'd be great. And I'll keep up with CareLoop as well.
All right. Yeah, we'll talk to you soon, okay?
Okay. Thank you.
Thanks, Dr. Erowele. That about does it for me and Dr. Erowele. Great stuff today. Just as valuable as I thought she'd be. Incredible tips for all the caregivers out there who are dealing with situations like she's going through with her own family members and siblings, taking care of her father and still managing to raise kids and have a job and all this other stuff that she's doing. So definitely pay attention to what she's saying and check out her first issue of Carenovate Magazine. I'll have the links right here on the episode page, and anything that you might need from her, any questions you have, be sure to get in touch with me, and I'll be sure to relay those to her as well. So again, a big thank you to her for taking the time to come on and share all this great insight. Before we sign off, one last reminder to please subscribe to the show. It's super simple. It takes you like 5 seconds. You can do it right here on the website, or go to healthsparx.com/subscribe. Just my way of delivering the episodes to you every Tuesday morning. I've had some incredible guests on the show. So if you haven't had a chance to check out some of the other shows, do so. Each episode runs about 25 minutes or so, but tons of great platforms, tools, advice, just general education and knowledge about what's going on in healthcare right now that would be great for you people to check out. So if you have any questions, let me know. I think that's about it for today. So until next week, I hope everybody's having a great week so far. I'm your host, Michael Walsh. We'll talk to you soon.